Good afternoon and welcome to Security Risk Analyses Done Right, a complimentary webinar from HealthSystemCIO.com, sponsored by Fortified Health Solutions, a Santa Rosa company. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com, and I will be your moderator today. We encourage questions. We think this is certainly a topic that will elicit them, so feel free to send them in as they occur to you. Type them into the Q&A box, the lower right-hand corner of your screen. We'll leave the default set to all panelists and send them in. I'll be looking at those, holding them, and posing them later in the program to our speaker. We have the URL in front of you to download the deck, which you can do at any time, and we encourage you to do that. I'll also send it out in the chat box. And we're going to have an archive available. The event's being recorded. Should be ready within 2 business days, and you'll receive an email when it's ready, and a separate registration is required. So, real quickly, just so you see how we're going to spend our time today, we're going to go approximately 45 minutes. First, we're going to hear from Chuck Podesta, CIO at UC Irvine Health. Then we'll hear from Troy McClendon, President at Fortified Health. And then we'll have our Q&A with Chuck. So without further delay, I'm going to turn it over to Chuck Podesta. Chuck?
Okay. Thank you, Anthony. I appreciate it. Thanks for joining, everyone, and I hope you get some good information out of this webinar. I'm going to talk, focus completely on the risk analysis, and I think it's really the foundation to a good security program. If you do this piece right, everything else will fall into place for you. So if you look at, again, all the threats that are out there, we see it, we've probably felt it. I'm sure plenty of you on the call have had issues around maybe one or all of these particular threats. The security risk analysis is important to really be able to identify, these various threats, and then also be able to put things in place to mitigate the risk associated with all these different threats that are out there. So it's just not HIPAA either. You look at everything that's out there, and if you just follow the HIPAA protocols, yeah, you're following the law and you're doing a risk analysis based on HIPAA. And that's okay, but you really need to broaden it, and of course you need to take into account the high-tech requirements that are out there now. But also there's something called high trust that I think is worth following and moving as close as you can to the high trust recommendations. There's something called the payment card industry, PCI, so if you're doing, taking credit cards, anything along those lines, you've got to follow those rules. You've got NIST and also ISO, and then of course there's a Federal Trade Commission, and then you have your own state laws. So when you look at your risk analysis, you really got to take all of these things into the plan, and making sure that again, it's not just not following the HIPAA protocols. So that's really important as we kick this off. On the high trust side, just as an example, they have something called a Common Security Framework, or CSF, as you can see, and it's in these 5 main areas: risk assessment, corrective action plan, policy management, incident management, exception management. So there's a lot of information out there on high trust. You can go on the website to take a look at that, but what I'm going to focus on is more the top bullet is the risk assessment, which again is the foundation to everything. So when you look at a risk assessment, what I call risk assessment harmonization, and again, it goes way beyond meaningful use. So again, you're doing a risk assessment associated with meaningful use stage 1 and stage 2, you have to take into account all these various areas. But what you want to be able to look at is in these areas: data management, network segmentation. You can see it, system controls, encryption, all the way down to risk transfer. You really want to look at your current state, and then look at kind of the minimal state that you actually need to be in, and then what would be optimal. So there may be a threshold that you're looking at that gets you almost there, and then there's an optimal state that you want to get to. So as part of this, you really need to kind of create a spreadsheet of these items. Then what is your current state? What do you have planned? What's the minimal? What's optimal? and then what is that gap to get you there? And that becomes your remediation plan going forward once you do that. So I'm going to talk about each one of these sections just so you give you a breakdown of each one so you get an idea of what I'm talking about. So on the data management side, really what you want to create here is what's called a sensitive data map. So you're looking at structured and unstructured PHI, and also, again, you've got to take credit card data into account because of PCI. And as part of that, you're looking at the data lifecycle. So what is your retention program for PHI? How do you access it? How do you audit it? And what is the minimal necessary that, from an access standpoint, that you're going to allow? So from this standpoint, again, you've got to look at your current situation, what you have planned, what is minimal and what is optimal around the data management side. Network segmentation. I only have one bullet here because it's really around your local area network and your wide area network segmentation, and this is really important for PCI. Most of the time for PCI compliance, you've got to have a separate network that's segmented off the main network, and it's pretty much closed from the standpoint of credit card transactions. If you don't have that in place, you're probably not PCI certified, and you shouldn't be taking credit cards, that's for sure. So you really want to look at what your current state, again, is, what you planned, what's minimal, and what's optimal around segmentation. It's really important. System controls, again, you get to computers, mobile devices, removable media, peripherals. You've got desktop, laptops, servers. You can see the PDAs, backup tapes, CDs. Can't forget those. Printers, copiers. You can't forget those. There's been breaches around copy machines because there is PHI stored, especially when it comes to the scanning aspect of it. So these are all areas where you want to have solid controls in place and take a look at what your current state is, again, and what's minimal and what's optimal. On the technical control side, it's network access, data management, configuration management, and log manager. And these are where the tools come into place. And, you know, most everybody has policies in place and a policy-driven security program, and that's great. You need to start there, but you really need to start transitioning to more of a technology-based security program. And under technical controls, this is where these tools come in, so that, you know, you need to have, from a network access standpoint, system authentication, you know, strong passwords, that sort of thing. IDS and IPS, which is an intrusion detection, intrusion prevention type systems. Again, you need to purchase those and implement those. You need to do a vulnerability assessment, and that's typically you hire an outside company, come in and do penetration testing on the network, and you know, give you a report as to what they found. So you want to do that as part of the risk analysis. Under the data management, one of the key components is data loss prevention. That is huge. If you do not have DLP installed, I can guarantee you have PHI, you know, flying out of your organization on a regular basis. I've implemented a couple of DLP programs at a couple of organizations, and, you know, as soon as you turn it on and you start quarantining emails that have PHI attached to them, and looking at those, you'll see right away that, you know, it just didn't start that day that you turned on the data loss prevention. It's probably was happening prior to that. You just didn't know about it. So of course you're not in a breach situation because you didn't know about it, but it was still happening. That's a key tool. Configuration management around the server, desktop, network, making sure that that's solid from a virus protection is key in that area. And then log manager, of course, on the application side, you need to be able to log and audit what's happening with access there. And then an incident management tool called a SEM, which really pulls all the logs together, but also allows you to really map as to where the threats are coming from. So with a SIM tool, you'll be able to see kind of that you're being attacked from China and from Russia, and, you know, how many emails have spam and how many have virus, and how your network is being pinged on a regular basis. I know when I was at Fletcher Allen that we were getting about 160,000 emails per day from the outside, and only 40,000 were legitimate. The rest were spam and virus that were being stopped. So the SIM tool tells you that and helps you kind of manage that. So as part of your assessment, this is one area you really, really need to focus on. This by having solid technical controls in place, you'll keep yourself out of a lot of trouble. Encryption, again, this could be under the technical controls, but I like to call it out separately because, as we know, most of the breaches that we're seeing out there these days are related to encryption, and there's really no excuse. I talked to other CIOs and about this, and every time I see a breach and it's a laptop that was stolen and it wasn't encrypted, I just shake my head because this is not hard to do. I know it costs money, and you need support from the C-suite to do this. But all you need to do is walk them through a breach, and it always ends with the CEO apologizing to the community. And typically, the CEO does not want to be in that position. So, hopefully, you get the money for encryption prior to having a breach, but you certainly get it after the breach. That's for sure. It's not an issue at that point, but it's too late. So you want to look at it in two ways, though: data at rest. All your database and file storage, backup tapes, the cloud, workstations, laptops. And again, your DLP can help you do that because your DLP can help map out where your PHI is across your network and your servers all the way down to the C drive of a particular PC. So again, some of those technical tools can really help you map that out. And then you want to put a program in place to really look at how you're encrypting that and how you're protecting that. Because you could lose a server, somebody could break in and steal a server. So it's not just workstations, laptops. And then of course the data in motion. Again, DLP is huge for this from the standpoint of email, FTP, being able to quarantine PHI before it heads out the door, so you can do some analysis on it. Is huge. Having mobile device management tools in place for the tablets. And also, being able to encrypt USB and flash drives. That's extremely important because those are moving around the organization and outside the organization as well. Don't forget about interfaces because you do have data moving from one system to another system, probably to an interface engine. So again, that needs to be looked at and encrypted as well. And of course, texting, which everybody's doing these days. And especially on the clinician side. So you need to have, products that will allow you to encrypt that as well. So you've got to, as part of your risk assessment, take a look at all of these areas and see where you are and how you stack up with industry standards, and then plan a remediation effort around that. So again, it's critical. User awareness, another section, really big. It's part of your risk analysis. Everybody's policies in place. You need to educate around those, but also just really teaching the organization. They're your frontline people as well. So, if they know how to recognize spam and viruses, they just become, part of your arsenal to eliminate those types of threats. So as much as you can educate them on that, where the devices are placed in, their office or out on a registration desk, how they access that, or the doors locked at night, auditing capabilities associated with that. When I heard my CISO, Chief Information Security Officer at Fletcher Allen, she was from the military, and she came in from her interview, and she had to walk from one end of the building to the other, and she sat down and basically said to me that she could have had an arm, under her arm, she could have had probably 3 iPads and a couple of tablets and maybe a laptop, without anybody knowing it from her walk. And I hired her at that moment because I thought that was great. But it's not just the virtual data; it's also the hardware itself. And you have to have a culture around, locking your doors and offices and things like that, because it will happen. On the process side, again, with encryption, getting people to understand how important that is, and that, if they do have a device that happens to be, made it through some process you had but did not get encrypted, they need to know that that's important to get it encrypted. And then the threat awareness, which I talked a little bit about, was just the, being able to recognize those threats and what do they look like. And again, it's because that's where you run into issues, especially around viruses. Something comes in, something clicks on it because it looks real, and off you go. And the more people are aware of that, it also helps them. I think it's a community service too. It helps them at home with their home use as well. So I think it's important in both aspects of a risk analysis to take a look at both work and at home. Auditing and monitoring, extremely important piece. So you need to look at what you have in place for those areas. Again, looking at your network management, network access controls. Can people just plug into the network and, from any device, or do you have that controlled in some way? We talked about data loss prevention. That's definitely a solution. Log management, application event management, database managers to really audit, what's happening with the databases, and an email auditor. Again, that could be data loss prevention doing that as well. And then we talked about a SIM tool, which kind of pulls it all together in kind of one place that can be monitored in a real-time fashion. So it's real important, once you get these tools in place, once you go through the risk analysis, that in this section here, you want to really look at your audit and monitoring capabilities. And then finally, the last component, which is what I call risk transfer. And this is an area where I think this is really starting to grow. And you can see by the bullets there, a lot of your organizations are probably moving in this direction as well. But it's really transferring the risk to other organizations or other companies. Again, it's you're still responsible, but at least from the standpoint of the way the laws are written, that if you did have a breach of your data, you would be involved in that breach, but from the standpoint of paying for it, fines, things like that, you've transferred that particular risk to another organization. So I think you're going to see more and more of this as we go in the future. So you've got cyber insurance, which everybody should have for breach insurance, application service provider services that are out there. Again, cloud services, vendor-managed systems where you don't really touch those systems. They basically manage those in a closed environment. Co-location, outsourcing, software as a service, the cloud. All those are areas where if you have PHI in an application and you're using vendors in this fashion, that you've transferred that risk to them. You do want to make sure you have, of course, the BAA in place, but also you want to make sure what their security programs are like, and you really need to just sign the BAA. In my mind, it's not enough. I definitely challenge them to produce either their last audit or have them walk you through their risk analysis process, and just make sure it's up to par. And I think the larger companies probably are in pretty good shape, but there's a lot of small companies out there that really haven't followed the Omnibus rule from 2013 and are really lacking. The only thing that's saving them is the OCR hasn't really stepped up on enforcement because there's just so many of these breaches going on. They just don't have enough manpower to go out there. So you're really only seeing OCR getting involved in some of the bigger breaches that occur as opposed to the smaller ones at this point. But that could change at any time. So just the keys to a successful risk analysis plan, you need the C-suite buy-in, because as you go down through those and you look at your current state and you look at your optimal state that you want to get to, that's going to cost money, especially when you get into, if you look at the technical controls and the things you need to have there. And you need that C-suite buy-in. And again, I know it's difficult, and I've talked to other CIOs who can't get their CFOs and CEOs to pay attention to this. But really what you need to do is just walk them through a breach of greater than 500 patients, and you'll get their attention. And the fines that are involved, the CEO apologizing to the community, things like that, the embarrassment to the organization, it will definitely, hopefully, get their attention. If it doesn't get their attention, then you really have to look at your organization and see whether you really want to work there. Because when a breach does occur, as a CIO, you are, it's going to be you. Unless you have a plan in place that has compliance involved, your Chief Information Security Officer, your legal side, all working together and understanding that, a breach is, as you can see, it's if, but it's not if, but it's when. It will occur at some point, no matter what kind of plan you have in place. You will get some sort of breach. It's just large organizations and people trying to do the right thing, but it does occur. And you want to make sure it doesn't fall on you as the CIO, that everybody looks to you and say, well, you're responsible for security. Well, no, it's an organizational responsibility. And again, that's why you can't do it alone. The organizational awareness, really key. You got to send your Chief Information Security Officer on the road to medical staff meetings, all the different department meetings, just anywhere there's an audience, put together a program and just, newsletters, things like that, and just it's something that's extremely important and will pay dividends in the long run. We talked about the funding. Monitor your BA readiness. That goes without saying. I mean, you need to have a solid way of tracking those, especially with new vendors, but also updating with old vendors, and just just like you're managing your contracts with these vendors, you need to manage your BA readiness as well. And then implement the corrective action plans. If you have a company come in and do remediation or penetration testing or other type of risk analysis work, and they come up with a remediation plan, you need to implement it. And then the last but not least is, if you don't have a Chief Information Security Officer, you really, really need one, with a team under that individual. Again, that costs money, but it's extremely important to have. And again, if you ever audited, what they're going to look for is, a culture of compliance. And, if you have all these things in place and you've done your risk analysis and you still had a breach, yeah, you'll probably get a fine, but it will be a lot less than if you don't have a Chief Information Security and you don't have an organizational awareness program. Those are the things that will red flag you, and OCR and other organizations will take a dim view of that type of culture and really hammer you. And I'm sure you've read stories about that, across the United States. So that's pretty much it from me. I think we're on time. I'm going to hand it back to Anthony. Thanks.
Thank you very much, Chuck. As always, very informative and interesting. We're getting some good questions. So with that, I now want to turn it over to Troy McClendon, President of Fortified Health, who's our sponsor today. Troy, you have the control.
Thank you very much, Anthony, and thank you everyone for joining today. As Chuck presented here, and not only the importance of a risk analysis, but actually properly conducting a risk analysis, it's ironic that the biggest misstep in a recent privacy and security summit by the OCR is that covered entities and business associates are still failing to conduct a thorough risk analysis. And to dovetail onto that, the failure to actually address the results of a comprehensive risk analysis. So in the next couple of minutes, I just wanted to discuss what to actually do with your risk analysis results. As Chuck mentioned, there's multiple threat vectors, and it's very important to extract the data mainly from the administrative risk, the physical risk, and the technical risk, and all three of those safeguards should be properly addressed during a risk analysis. So it's important for the covered entity to prioritize those risks if it's not already sorted in the report, to actually determine the effort it would take, whether in-house or third party, to remediate the risk, identify key staff members that would participate in those remediation efforts. Again, do you have those resources internal? Do they have the skill sets to address the administrative, physical, and technical? And if there's any outside resources that need to participate in those remediation efforts, whether that's from your EHR vendors or all the way down to networking and infrastructure. What you're probably most likely going to prepare for once you get the risk analysis results, you need to be aware that the organization may not have the adequate resources to complete the required remediation. You may not have the in-house skill sets to complete that required remediation. And from extracting that data, whether it's administrative, Chuck mentioned policies and procedures, all the way to technical controls, that could equate to additional training, staff training, capital investment for those technical controls, governance. Chuck also mentioned having to buy in at the C-suite. A lot of times when we conduct a risk analysis, we do get that pushback or the investment dollars that it would take to implement a proper security management program. There's going to be differences of opinion once the risk analysis results come out. Low-hanging fruit would be password management for us. We always see if there has to be a more stringent password policy, making that a more difficult string of characters, upper, lowercase, how often that changes. There's always going to be a difference of opinion in how you deploy such a policy or procedure. And stricter employee sanctions. We mentioned training and awareness being a key event now to actually educate staff members on not only protecting their unique user ID and passwords, but also the computing assets, whether that's portable devices or office keys, badges, and so on through physical safeguards. There's going to be remediation that, again, could require implementation of new technologies. This could equate to increased budgets, things you've not seen in years past that really need to get through budget. I can tell you encryption is key. Data loss prevention, or DLP, as Chuck mentioned in his slide deck, is also key. That is such a preventative and safeguard tool for healthcare these days. It's one of our strong point solutions that we provide as well. Capital investment will go up. Skills training, not only from a security training and awareness, but actually technology training and awareness. And again, whether that's in-house training or third-party training, key area. And then outsourcing, multiple covered entities that outsource components of their network. So key considerations. But you can make sure that remediation is going to require the organization to implement ongoing security processes. We can't stress enough through our services that it's an ongoing process. It's not a one and done. And it's very important that you establish a security management process that shows risk mitigation or reducing identified deficiencies through a risk analysis and how those are addressed. So with that being said, I'm going to pass it back over to Anthony, and we can address any questions at this time.
Very good. Thank you so much, Troy. Appreciate the presentation. Now we have time for our Q&A, and we're already getting good questions in. So let me start by asking you, Chuck, it's kind of a general question, a high-level question. What method or process do you use, and how often do you perform a risk analysis?
We do a risk analysis every single year, and based on that risk analysis, we come out with a remediation plan. And we actually have we don't do this internally, although legally you can. One of the things I would recommend is you don't try to do this yourselves. I mean, you can do that, and you can do a self, but it doesn't make any sense. It's like doing financial auditing and doing your own audit on your financial books. It doesn't make any sense to do that. You want an outside company, unbiased opinion to do that. So I would urge to do that first, and then have that done once a year. They'll come out with a remediation plan. Along with that, though, is we do quarterly penetration testing. So you just don't want to, not do anything while you're doing a remediation plan. You still want to be actively engaging the network and looking for threats along the way. So you want to do that on a quarterly basis. So risk analysis at least annually. Some people I've seen have done it twice a year. That's okay as well. But quarterly penetration testing is key as a component of that.
Any more thoughts on the method or process, or did you cover it?
I think I covered it, yeah.
Okay, very good. Any thoughts around a successful strategy for getting clinicians, specifically physicians, using a secure text messaging application? We have an application in place, but participation is only mediocre. I think the point is that they're still doing it outside of the application that would help it be secure. And so your thoughts there?
Yeah, that's about. I mean, you need to really implement a mobile device management solution, like an alert watch or something along those lines that would actually take control of that device and force the encryption. So, in that particular case, the physicians don't even know that the text is being encrypted. It's being managed by a software program, and the device has been registered. So as part of your BYOD or bring your own device program, you need to have that registered under your mobile device management system. And that's what we do here. So whether it's an iPad or an iPhone, that it is encrypted. There's a virtual kind of company space there that can be wiped clean if the device is lost, but it's automatically encrypted, and any messages that go from that device to another device are encrypted as well. So.
Very good. How do you answer the CEO and/or CFO when they push back? So if you let me explain it to you this way. So if you're out there and other CIOs are out there, we've had them on, who are saying it's not if but when. And could they come back to you and say, well, then why should we invest all this money if it's going to happen anyway? I think that's the question. What's your response if you should get that kind of argument back about the investments being made in security?
Well, it's a magnitude of what is going to happen. By making the investments, you can limit your damage to, that $1.5 million the threshold. And if you have cyber insurance as part of that, you've really mitigated, the cost to your organization. Yeah, sure, you're still going to have the embarrassment and lose some credibility and do things like that, but at least you've mitigated. If you don't have a security program in place, you are looking at fines that are astronomical. I mean, if you look at some of the big organizations that were out there that have these massive breaches, they're looking at $150 million type fines, and a lot of that is based on not having a culture of compliance, not having these tools in place. So to me, the ROI is, taking a $10 million fine down to a $1.5 million fine, and couching it in those terms if you can possibly do that.
Right.
Once you have the breach, the other thing I would tell them as well is once you have the breach, it will be so bad that you will come to me and you would ask me what I need to do to make sure this doesn't happen again, and I will give you all the things that I gave you prior to that breach that we needed to do, and then you will pay for them at that time. And so, that's typically how it goes. Yep.
Great answer. Great point. What is the scope of your penetration testing? Is it internal and external, or only external?
No, both. You want to do external and internal, because a lot of your threats can come from employees, internal employees. You can have bad actors in your organization, so you want to be able to see if you're secure from that standpoint. Your access controls are solid, and you want to look at that. External goes without saying. You want to look at public-facing servers and things like that. You want to identify those quickly so you can mitigate risks from the outside. But if you look at if you see a lot of the breaches and a lot of things that have occurred, it's been the registration clerk or the billing clerk or somebody who has access to PHI. Stealing that information and filing false tax returns as an example, and that's not external in a lot of cases. So you want to look for that.
Okay. What is the difference, if any, between the security risk analysis required for meaningful use and that required for a HIPAA assessment?
They're pretty similar. I mean, HIPAA is definitely more robust than meaningful use. But I look at meaningful use as kind of the minimum requirement for a risk assessment. If you look at that, it's really, the firm that we use, they come in from the outside and they of course do the risk assessment for meaningful use. That takes them a very short period of time, and they basically document it in one page that, on these different controls we have passed. So if we ever get audited, we can produce that from that firm. And then they go on to do the full risk analysis that you saw that I went through, which is much bigger, much deeper, looking at all the technical controls and things like that, the administrative, the physical, a lot more than what the meaningful use does. So, and again, I would go beyond HIPAA and look at HITRUST and excuse me, and how they handle risk assessments and the NIST standards and ISO standards, and really put a program together that takes the best of all those risk analysis programs and take it as far as you can. Again, there's no kind of wrong way to do this. If you're taking it as far as you can, you're absolutely going to have less risk in your organization.
Very good. Next question. Please discuss trends in information security reporting structures, movement towards a chief risk officer, or staying with the CIO.
No, I think there is some move in that direction. I think what you're seeing first is, people getting on board with the CISO and hiring that person, getting that person in there. And then what you're seeing now is a team being brought under. Typically, the CISO is kind of just a policy person and point person for security. But now you're seeing a team that works under that person, 4 or 5 people who are security analysts, working on access controls, being managed by the CISO. And then that CISO works in conjunction with compliance and your risk organization to create kind of like a triumvirate that would handle, manage breaches. So in my last organization, those 3 individuals, the director of the risk management program, director of compliance, and then the CISO worked together. They had a monthly meeting on doing mock breaches and things like that. But I still see that piece under the CIO, the CISO piece, not so much the compliance, which is more on the privacy side. I think that's outside of the CIO's realm, but I don't see the CISO moving out from the CIO anytime soon.
Okay, that was a question. Where do you see the CISO reporting? So you're typically seeing it come up to the CIO?
Still coming up because of the tools that need to be implemented, and I think if you had everything, you bought everything, you got everything in place, and you were more around just doing risk analysis, remediation, keeping up to date on the latest and greatest things that are out there, then I could see, the CISO reporting to another, maybe compliance or something like that, because you're in more of a maintenance mode. But what I see out there right now, there's not a lot of organizations that are that far along where you could do that.
Okay, great. Can you talk about clinical equipment risks on the network?
Oh, it's huge. That's one of those vendor-managed areas typically, and you see it in, say, radiology, cardiology with PACS and some of the other systems that are there, and also with the modalities themselves, with CTs and MRIs, and so there's PHI all over the place, and a lot of these systems are closed. They don't allow you to put virus protection on them or update the virus protection that's already on them. I've been in situations where we basically told vendors where we did have a virus attack, it got into those systems and we couldn't remediate it, that basically we will replace you. We will, it will cost a lot of money, but we will replace you, and we will find a vendor that will allow us to manage that piece of equipment like we would manage a server or a PC or anything else. And I think you really need to push that. And as these things come in the door, working with your supply chain side in making sure that BAs are in place and that you have access for virus protection, it's up to date, and all those things are part of the contract before these pieces of the clinical equipment come in the door. It's crucial at this point.
Well, this kind of dovetails with it. Do you do any ongoing risk assessment work as new applications and systems enter your environment?
Absolutely. It's part of our enterprise architect team. Any type of new software goes through, of course, an architect team to make sure it's fits with the platform that we have and it's going to run. But as part of that, our CISO is involved in that as well, and they do a security check on that particular vendor and software, and again, they handle the BAs and make sure that's all in place. They actually, will talk to the vendor about their security risk analysis program. Hopefully the vendor will share it with us. We're pushing more and more for that as we go along. Before any new application comes in the door, the CISO is part of the team that signs off on it. Mm-hmm.
Very good. Forgive me if this is repetitive, but does your external risk assessment include clinical equipment risk assessment? Yes.
Yes, absolutely. I mean, you have to look at your clinical equipment as a device that's attached to your network, basically. And if it's attached to your network, it can be hacked just like anything else can. So, yes, absolutely.
Great. Next question, how do you feel about encryption on servers and SANs? If the disks are always in motion, can encryption be beneficial?
Yes, no, absolutely, because the disks are always in motion, but it's still data at rest. I mean, it's sitting on those devices. It's not, you know, until it's accessed and it's moved out to another device, it's sitting on that. And to me, it's extremely important because, you know, people are starting to get, you know, desperate for money, and you're seeing it all the time as they're breaking into data centers. You know, they can steal a server, and if you have that server sitting there and it's not encrypted as part of your data at rest program, you've got a breach right there. And so, you know, in small doctors' offices, you see it all the time. These servers are, you know, behind a locked door, but, you know, somebody breaks in, it's gone. So I think it's just as important as, you know, encrypting a laptop or any other type of device.
Very good. How are you vetting cloud service providers?
The same as any other application provider, although we go a little deeper because we do want to see, since our PHI is in the cloud, just signing a BA is not enough. We do go through a process where we want to see your risk analysis, we want to see the results of your last audit before we do any of that with the cloud. We go that extra step and require that before we sign on with them. And again, I would definitely, you know, tell people that you've got to take that extra step with a cloud provider because you just don't know where your PHI is once it's out there, and you want to make sure they're protecting it as well as you would, you know, inside your organization.
Very good. This may be our last question. We're a medium-sized multi-specialty practice with about a dozen locations. We obviously have a much lower budget than a hospital. What is the minimum resources we should have to protect ourselves? We don't have a CIO, much less a CISO.
Yeah, so that's the problem. I mean, I see that everywhere with these small practices, is they just don't, you know, you just don't have the bandwidth or the resources to do this. And so I mean, to me, the minimum necessary is encryption. You've got to figure out a way to encrypt all your devices, whether it's servers, laptops, whatever it is, you need encryption in place. Of course, you know, data loss prevention would be great, but that takes resources. It costs a lot of money. You're probably not going to be able to do that. So the encryption piece, in my mind, email encryption, you know, encryption of data at rest, data moving, that will save. If I was going to do one thing and spend money on one thing, it would be that.
And the security risk analysis part of that is showing that you did as much as you could and as much as a reasonable organization could. Does that make sense?
Exactly. I mean, yeah, you know, they're not looking for you to bankrupt an organization to put in a security program. I mean, you know, that's impossible. But they are looking for a culture of compliance, so you need to have your policies and procedures updated and ready to go. You need to have that user awareness program. You've got to implement that. I don't care how small you are. You've got to have that done, and then I would add for the technical controls, the encryption piece, and, you know, you've pretty much done as much as you could at that point.
All right, very good. Well, that was a wonderful webinar. I think there's tons of great information in there. I want to thank you, Chuck, and I want to thank the Fortified Health Solutions and Troy for sponsoring the event. As I mentioned, you'll get an email when our archive is ready within 2 business days, and a separate registration is required. For those with the CHIME CHCIO certification, don't forget to let CHIME know that you've attended. Attending each of our webinars gets you 1 CEU. If you've asked for us to communicate that to them for you, we will do that. Questions, comments, always please email me. Our goal is to make sure this webinar program stays the best in the business. And you can go to our website to see our upcoming schedule in the last 12 months of archives. So once again, I want to thank Chuck, I want to thank Troy and all our audience. Everybody have a wonderful day.